I am Radhouane Ben Farhat. I am the Chief Sales Officer of Enova Robotics. Enova Robotics is a company specialized in artificial intelligence and mobile robots for healthcare application and for security and safety application. So our main expertise is autonomous navigation and object anomaly detection. We are a team of 30 people between Sousse in Tunisia and Paris in France. So we are based in Tunisia and in France. And as a leading robotic companies, we design, we develop, and we manufacture our own branded robots. So regarding the healthcare robot, we had to resolve the caregiver shortage. For example, in Germany, there is more than 35,000 vacant positions for caregivers. By 2026, in United States, 7.8 million unfilled jobs in healthcare for healthcare givers. All that, on the other hand, by the 2025, the global population of aged persons over 60 years will be about 1.2 billion. So there is a global aging population increasing, and there is a global shortage in caregivers. In 2016, we started developing the VEASENSE robot, the healthcare robot to assist caregivers and doctors, challenging the global shortage of healthcare of caregivers.
Sorry to interrupt you. I'm not sure if that is on purpose, but we don't see your presentation. We see you, not your screen.
Okay, excuse me.
Sorry for...
Yes, I'm sorry. Yes.
Now we see both you and presentation. Please.
Okay, very good. So in 2016, we started at Enova Robotics to try to find a solution to resolve the global shortage in caregivers, and we developed the VEASENSE robot. So the main idea was to automate the repetitive tasks of caregivers by a robot. There is a number of repetitive tasks done by the nursing staff, and which doesn't need a real human intelligence. So we automate that tasks in mobile robots to let caregivers focus on tasks who needs human intervention. So the mobile robots solution provides physical interaction, patient care, and data processing. So with the VEASENSE robot, what we bring to healthcare sector is to make primary diagnostics in a remote location. So patients and staff in remote clinics can conduct remote tasks, real-life primary diagnostics regarding anxiety, pain, fatigue, visual diagnosis with the camera embedded in the robot, real-time chat. And starting from last year, we embedded some medical measurements devices in the robot, and we can take measurements, patient measurements regarding temperature, regarding pulse, and regarding oxygen rate in the blood. So since the start of the pandemic, the robots helped hospitals and clinics in Tunisia and France to keep medical staff away from risks of contamination. So patients in hospitals are supported by doctors and caregivers remotely to minimize the risks of contamination. So the doctor doesn't need, or the caregiver doesn't need to go 10 times to see the patient. He can go 2-3 times to make some physical diagnostics, but for the monitoring and for the caregiving, we can caregivers can do it remotely, and keep them away from risks of contamination. So more than 50% of hospital deaths occur in patients who are not continuously monitored by medical measurements done by the robot in a continuous way. We can detect early patient deterioration and report physiological instability. Regarding the telemedicine, so in case of patient deterioration, the robot sends alert to assistance centers, activate real-time voice and video communication between patient and the operator, doctor or medical staff, and the doctor can make primary diagnostics and advise the patient about the first action to take. One other important point regarding the patient recovery is the social link maintained. So the robot allows patient and their family in a remote location to maintain contact and be in a continuous contact with their relatives. One of the big challenges for us was how to make this technology as trusted technology. The robot will operate in hospitals, clinics, medical centers, nursery homes. So it's very important to make the technology secure and to make it autonomous, while keeping people secure with autonomous navigation, collision avoidance, and data encryption. So with VEASENSE, we shape the future of healthcare segments. We operate diagnosis for patients in remote sites, facilitate patient monitoring, timely communication, and high-quality emergency consultation. We are a social link between patients and their families, for patient morale and recovery, and we solve the caregiver shortage. In time of pandemic, we have deployed the robot in hospitals and clinics in Tunisia and in Europe to help medical staff to be away from risks, and the robot really proved its added value. With the data collected by the robot, we can predict future diseases. Let's imagine together if, for example, we have 100 robots deployed in medical centers in Madrid, for example. All data collected by the robot can let professionals to predict future diseases, to develop more effective medicines, to really impact the behavior and increase the awareness and the improve quality of life for patients. Finally, I would like to show you some pictures of the robot working in the hospitals. So as you can see, the robot is in contact with people, with patients, maintaining doctors in a secure room away from risks, and letting them focus on more tasks needing intelligence, human intelligence. Thank you for your attention.